This is a summary and explanation of the behavioral statements in domain 2.2 on patient counseling. So there are 9 behavioral statements in domain 2.2. There's behavioral statement A, behavioral statement B, behavioral statement C, behavioral statement D, behavioral statement E, behavioral statement F, behavioral statement G, behavioral statement H, and behavioral statement I. Oh, okay. That was a lot. So for behavioral statement A, you're supposed to assess the understanding of the patient, not your understanding. It's supposed to be patient focused. So you assess the understanding of the patient on the disease condition that they have or the condition that they have. Then you need to establish what they understand about the medication that was then prescribed to them. So these 2 things. You also need to provide or check for a counseling need, which means that you're supposed to know why or what you're counseling the patient for. You need to state this. What is the reason why you're counseling the patient? Behavioral statement B is about counseling. When you counsel the patient, you need to provide information on the rational use as well as on the safe use of medication. In this case, you could provide information on the contraindications of the medication. You could provide information on the dosage, the side effects that they can experience, and how they are supposed to be storing the medication. Behavioral statement C is a compound behavioral statement whereby you're supposed to provide show understanding of active and reflective listening. So active listening is being present. Have you ever had someone who says, you are here, but you're not here? So you need to show the patient that you are here, eliminate distractions. Then reflective listening is paraphrasing and repeating the information, but you can check the definitions of this. So it's important that you're able to show that you are able to apply both. Behavioral statement D is providing or counseling according to a counseling plan, which you can establish from the counseling need in behavioral statement A. Behavior statement E is about maximizing on counseling opportunities. This could include optimizing the environment, removing distractions, as well as using an appropriate language that the patient can understand. It could also include your presentation. So how you present yourself to the patient, maximize on counseling opportunities. Ensuring the name tag is on, ensuring you're wearing a badge in an appropriate counseling area. Those things are important. Behavioral statement F means you are checking and demonstrating understanding on that patients may prefer other healing customs. This could include complementary medicine and maybe allopathic medicine. So you need to show that you are able to ascertain and show sensitivity to this. Behavior statement G is about using a language that the patient may understand, and is also applying cues. So it's verbal and non-verbal cues. Verbal is what you say, non-verbal is how you can apply stuff that's non-verbal. So how can you use non-verbal skills to counsel the patient? This could include nodding, pointing, and stuff like that. Behavior statement H is about instructional aid. Anything that has instructions, maybe written instruction, maybe a pamphlet, a brochure, or something that explains how to do a specific activity, depending on what you are doing for that patient, then this counts as instructional aid. Behavioral statement I is about patient feedback. So how, not yourself, obtain feedback from the patient on how the counseling session was, and then provide evidence for that.